Hello friends, welcome back one more time on my YouTube channel Dr.Nilesh Advice. This video I am recording after a long time, maybe after 1.5 or 2 months. I was finding some good topic to discuss. Finally I found some good topic to discuss. Today's talk is something related to the recent development like the back to school. Now there were holidays, summer holidays in the most of the schools. The school vacation was there and most of the children were either on a summer camp or they went to their home country, and as they are at home countries or at home, they are not exposed to the world. They are not going school, so they are not in contact with the other children. So almost they don't have any issues because the illnesses were less. Now as the children starts the school, their exposure increases, and that's how the children's sickness also increases. Most of the schools are going to open in a week or two. Some of the schools are already open and some children are going into the summer camp. So now back to school. So this type of the words back to school you will hear in the supermarket also, hypermarket also, because there will be a lot of commercial campaigning about the back to school, because it is a time for the commercial institute to sell their goods, children's stuff like the stationaries, backpacks, school bags, shoes, all those things. So similar way the back to school also increases the illnesses in the children, and most of the parents might have experienced this, that once the school start their sicknesses like the running nose, cough, all those things increases. Now this video we are targeting that how to prevent those illnesses, how to cope up these illnesses, and if the children will get those illnesses, what to do, when to go to the doctor, and which are the medications might be required, or what are the home remedies you can do at home. All those things we are going to discuss today in this video. So friend, most of the children do travel in the vacation time. They go to their home countries. They are going to get exposed to the various people there. The climate will be different, like in the some part there will be the raining, in the some part there will be the snow. So they are going to get exposed to the various country wise fluctuation in the climate. So like the Southeast Asia countries it is raining, western countries there is a snow, and some of the western countries are suffering huge summer heat as well. So the climate is different. Children are exposed to those climate at that time, but ultimately the illnesses are less because they are not get much exposed to the sick people. So that's why their illnesses are less, or they are in a different comfortable environment. Now when the children will start coming back to the school, they have to readjust with the new environment. So that's why what happened, that children's various system try to rebalance the life with the new environment. Like it might be more cooler than what it was before, it might be much hotter than what it was before. So body needs to get readjust. So it is very important that before you travel and come back to the country where the children are going to school, obviously the child should be in a good condition before travel. So while the traveling time the child has some running nose, cough, it might increase once you land in a different place. So that is very important. So before you travel, if the child is sick, better to get consulted with the pediatrician and then you travel. That is the number one, first and foremost thing. Now the second thing, you have to take care about the diet pattern, because when the children are at home their diet pattern is totally different, and once you start the school the diet pattern is different, the timings are different, at home they used to eat every half an hour, 1 hour, 2 hour, 3 hours, and many times there are no any scheduled diet habit. Now as they start the school, they have to wake up early, they have to take the breakfast and a long hour in the school, then they come back, they will eat, they will go to play, they will have a dinner, they will sleep early. Those kind of the routine will disturb their diet pattern and the diet habit. So it is very important whenever you start the school to start with the normal diet, avoid junk food, try to give the homemade food, healthy food, like you add more fruits in the diet, vegetables in the diet, avoid the cheesy material, butter, paneer, all those things to make the child adjust with the environment. The good food like the yogurt, buttermilk, vegetables, specifically green leafy vegetables, are very good for the children to build the immunity if they will consume in this kind of the climate change. So diet pattern need to be get little bit more adjusted with the new environment. Third thing is that whenever the children start the schooling, their sleep pattern get disturbed. Specifically in the smaller children, it is very difficult. Like first 5 years of the age, children generally require 7 to 8 good sound sleep, but as the school starts, they have to wake up early. They don't sleep in the afternoon, and even if you will tell them to sleep early in the bed, they don't sleep. So it is very important to counsel them that why it required to get regularized the sleep, because sleep is the time when our body try to heal whatever things happen, whatever injuries are happening inside the body will try to heal. The body will try to rebalance the thing when we are sleeping, because body will get time. So it is very important for the children to take the good amount of the sleep. So the pattern building of the sleep is important, pattern building of the diet is important. So these two needs to be get take care. Now another thing is about the vaccinations. Like as the school will open, the cases of the influenza will increases. At most of the places, like in the September, October, the influenza or the common flu cases are much more. So it is advisable to give the influenza vaccine or a flu vaccine to the high risk children. First 5 years of the age is considered as a high risk for the children who are suffering from any respiratory illnesses like the asthma, allergic rhinitis, adenoid hypertrophy, or children who has the heart disease, children who are suffering from the various oncological case, means the cancer cases. Those are considered as a high risk situation. They should take the flu vaccine. When you start the flu vaccine, if the child is less than 8 years of the age, there are 2 doses. After that, every year it is a single dose of the flu vaccine needs to be taken. Now many parents ask this question, till how long we have to give the flu vaccines? If the child remain in the high risk zone, yes, it is recommended to give every year. Like for us, healthcare professionals are considered in the high risk category, so that's why we are taking every year. Till now also I am taking the flu vaccine every year. So to provide the flu vaccine to the children is very important as the school starts. Now what else you can do? Like you have to monitor the children's symptoms. If the child is developing any symptom like the running nose, cough, common symptoms like the vomiting, diarrhea are also there, because they will change their pattern of their diet, so they will have the more amount of the vomiting and the loose stools. So to maintain the hydration is very important. So the children need to focus on to drink good amount of the liquid. It can be water, it can be soup, it can be juice, it can be some kind of the fruit soups you can give, so that they will maintain the good hydration. If needed, you can provide them the ORS also, lemonade also, that will maintain their hydration. So hydration to match the diet pattern, to match the food pattern, vaccinations, all these things are very important when the children are coming back to the school. The next important thing is that once they will go to the school, the activities, extracurricular activity also increases. Like they will start their physical education classes, football classes, or maybe some sports classes, so they will need more energy. So it is very important to provide them the food which provide them the good energy. So like the carbohydrates are also needed to provide them the good energy. So the diet plays a very important role when the children start coming back to the school. Now many times the children find many times the parents find difficulty to regularize the timings, because it is like the long vacation, 1.5 month or a 2 month vacation. So children might have forgot their schedule. So we have to regularize their schedule. We have to inform the children, we have to sit with them, we have to play with them, and then we have to counsel them that why it is important to schedularize or reschedule their timings. So the back to school is not a big task, but the smaller children, yes, has the problem. Bigger children get adjusted very easily. Like the bigger children, I mean by the 5 or 6 years of the age group, they get adjusted very easily. But the smaller children, yes, they find little bit more difficulty to get adjust with the back to school, new kind of the changes to them. Another thing which changes, like the climate changes, because the vacations are mainly as a gap for the children to not to suffer for the extreme heat or the extreme cold. So most of the places it is either it is a summer break or it is a winter break. So now when again the children will back to the school, so the climate has changed. So like if it is summer, then now it will be the winter. So that children's illnesses increases, because in the winter some of the illnesses are very common, like the viral illnesses increases very fast. So that's how children will start some of the running nose, cough and all those things. But yes, when to go to the hospital is very important. Like if the child has a persistent high grade fever, like child is running 103 plus or the 39-degree temperature very regularly, if the child has refusal to feed, like he is not able to eat well or he is continuously vomiting, he has lot of loose stools, diarrhea, severe abdominal pain, he has developed very prominent cough or the ear pain, or he develops any faster breathing, then yes, then you will need the checkup by your pediatrician. Your pediatrician will guide you the different medications that you have to give to the child on time, so that child will recover. So friends, I have tried to highlight the few important points related to back to school, what is to be done at home, what care you can take at home, and when to go to the hospital or when to go to your doctor. If you like this information, you can share the channel with the other people, other colleague, and you can like my videos and you can subscribe as well. Thank you very much.